when the world has got you down. And
Alzheimer's sucks. It's an equal opportunity disease that chips away at everything we hold dear. And to date, there's no cure. So until there is, we continue to fight with the most powerful tool in our arsenal, love. This is Love Conquers Alls, a real and really positive podcast that takes a deep dive into everything Alzheimer's, the good, the bad, and everything in between. And now, here are your hosts, Susie Singer-Carter and me, Don Priest.
Hello, I'm Susie Singer-Carter.
And I'm Don Priest, and this is Love Conquers Alls. Hello, Susan.
Hello, Donald. How's it going?
Terrific.
Okay.
It's a lovely day outside. We're actually getting some, weather more than 61 degrees for the first time in forever.
Yeah. We're not going to talk about weather, are we?
No. Just wanted to. I looked outside, and it's what came to mind. So what's happening?
Yeah. So not much. What's happening with you?
Well, we're still,
we're still brain dead from
Yes.
we're just finishing our documentary, folks. So this is very exciting, and we're just doing like all the spit and polish on No Country for Old People, and I want to thank everybody who has been amazing supporters of this project, financially and also just emotionally and spiritually and in our vision, and I think that we can't thank you enough, because this has been a beast of a project, and we are standing at the finish line. Now what do we do with it? That's the next big hurdle.
That's a biggie.
Now we got to get to the streamers, which is like, in case if anyone isn't in the entertainment industry, you probably won't know how difficult it is now. The industry is so changed, and it's just turbulent, and there's no rhyme or reason, and it's just like the wild, wild west out there. So we're forging ahead and trying to navigate this and find the best home for No Country for Old People, so that the most people can see it, because it's really important.
Yes. Yeah, because everyone just says, "Oh, just put it on Netflix." Not quite that easy, but sure, let's do that.
Right, yeah. And what's interesting is that like we have another film called My Mom and the Girl, which is about the day in the life of Alzheimer's with my mom, with Valerie Harper, and and that got a lot of distribution, and it's on PBS. And PBS, everyone thinks, oh, that's fantastic, which it is, but it's really more bragging rights, because it doesn't really reach the audience that we need to reach. So we're trying to throw a really wide net.
Very wide, because everyone needs to see this. It's such an important message.
Yeah.
But
our
onward.
guest today. Oh yeah, onward.
Yes.
Yeah. If anybody has any connections to the big streamers, we welcome them. We will thank you immensely. Yes, we're trying to get into all of them, any of them, and Hulu and Paramount, Apple Plus would be great, and Amazon. Did I mention Amazon? And
Now you did.
Now I did. So, yeah. Anything with you, Don? Anything exciting?
No, nothing. I mean, exciting is just the fact that every day we get closer to finishing. That's exciting. So, but no, nothing in particular.
Is exciting. For you, sleep is exciting.
Sleep is very exciting. I wouldn't know. Haven't had it in about 22 years, but yeah, let's go for that. But not
crazy.
now. We are not sleeping now. We have an amazing guest today.
Yeah. Who's really, you know what? I have a lot of questions for our guests. So get to it.
I bet she has a lot of answers. All right. Here we go. Author, practitioner, educator, management coach, presenter, mother, and grandmother. Dr. Ethelle Lord is a pioneer in the containment of dementia. Spending 21 years in the care of her husband Larry, living with vascular dementia and Alzheimer's truly motivated her career path. A global dementia care shaper, she is the founding president of the International Caregivers Association, a dementia management consultant, and creator of the Transactional Dementia Intelligence, or TDI, business model of dementia care, a whole system which includes management, training, care, and coaching. She has also authored the enlightening book, Alzheimer's and Dementia Coaching, taking a systems approach in creating an Alzheimer's-friendly healthcare workforce. As Dr. Lord says, one of the biggest challenges people face is the lack of basic information on where to begin, what to do, and how to do it. Well, this dementia warrior is helping the world face those challenges, and we are honored to have her with us today. So let's say hello to Dr. Ethelle Lord. Hello, Dr. Lord.
Well, thank you for having me today. I appreciate it. Nice to meet both of you.
Welcome,
Thank you.
Doctor.
Thank you.
I've been looking forward to talking to you for a long time. Social media is so incredible because it opens our world to people that we wouldn't normally get a chance to, be aware of. And I've been aware of your work, and I'm such a fan, and I'm a fan of your approach. And if you don't mind, I kind of want to just jump in and have you explain exactly what your approach is in terms of this system that you've created, the transactional, which I want to know why it's called transactional, Dementia Intelligence, or
Yes.
TDI.
Thank you. It's a system because we have a systemic problem. You cannot approach a systemic problem without a systems approach. And so the Transactional Dementia Intelligence business model is a systemic solution to the problem we have now. Really, basically, to say it in one sentence, it's opening a closed system. We have a closed system in dementia care today, and even long-term care. All of it, everywhere, is a closed system. And I'm not sure if you're aware that anytime you have a closed system, you're open to neglect, abuse, and death.
Oh,
So we
yes,
want
we're aware.
Right.
Yeah.
So we are the first ones to propose something to open the system with this TDI model. And I'm sure others will come down the pike. We're just one example, but we happen to be the first example. We have to start with one.
Before you go on, can you just tell me what a closed system is so we have a framework for what that means?
Yes. A closed system, let me give you a couple of examples. Like we have some groups, religious groups, they're closed. You have to follow all their dogmas and all that, and they're very strict. And if you look really closely, there's abuse in those systems. Politically, the same thing. So in the long-term care system, you can put your mother in the long-term care system, or your father. They'll welcome them as a resident and a client, or whatever they may call them, but they don't welcome you.
Right.
They don't want your advice. They don't want to see you. They pretend to want to see you, but they're very uncomfortable. And if you look at my latest post on LinkedIn, you'll see I have opened that can of worms. I've published many videos that show you the abuse that goes on a daily basis. We don't see that. I was just visiting a nursing home this weekend in Maine, and the person I was visiting is a lady, 89 years old. They said she threw herself out of her chair just the night before because she wanted attention. It's horrible what happens. Horrible. It happens everywhere. So we want to open that system, and by opening it, I mean we're going to include family caregivers and train them as TDI care partners. And they will be wearing a lapel pin that says that, so you can recognize that person has taken training and is allowed there 24 hours a day. So we're going to increase the staff. We're going to see when a person falls down or is about to fall down, somebody's going to notice that. Somebody's abused, is being beaten up or slapped with whatever they have to slap them with, it's going to stop because there'll be eyes there, a lot of more eyes, and we need more eyes.
Right.
The TDI also is structured because I have a background in management and leadership. I made sure that the systems approach that I created was also favorable for the ROI, return on investment, because that's what is governing the world today, globally. It's money that you can make. Well, the turnover and the burnout is, and the CNA, which is Certified Nurse Assistant, is over 100% in the United States. So if you just take that one figure, one classification, they're going to make money because the turnover won't be there. Why? Because the system I've created requires 6 hours of training for CNAs, but 8-hour pay. They won't leave. They will be trained every day. They will be supported by a dementia coach at the center of the organizational chart, and they'll be trained by that person, supported, everything. No, even nurses and doctors. Right now in long-term care, there's no support for anyone. You're on your own. Most administrators are simply managers for the business owner. And so they look at how they can fill the beds or not fill them. Whatever it's more advantageous financially, they'll do that. They'll take that step. With the TDI, it's not a program that we sell. It's a program we license. Why do we license it? We license it so we can keep control over the quality control. We want to make sure those CNAs do not work more than 6 hours, but they receive 8 hours pay. We want to make sure that the dementia coach is there every day to intervene with any challenges that come up. When I was visiting this weekend, for example, one of the residents was speaking French. There were no workers who could understand her. I was there and I conversed with her. She was very excited. She wanted to go home and she wanted to get out of her wheelchair and walk home. I was able to calm her down, but nobody there could do that.
Right. So, this is touching very closely to our documentary and the kinds of issues that we're dealing with, right? With the systemic issues and which are pervasive, and especially when you're dealing with people who have dementia, in terms of ableism. So my mom had Alzheimer's, and the people that are easily ignored are going to be ignored. They're the first ones to be ignored and dismissed and neglected and abused. And nobody is trained, like you said, in dementia or Alzheimer's care. Really nobody is. There's so much misunderstanding and assumptions and stigma, and it's rampant in the healthcare system. It's not just the world. It is or civilians, as it were. It is the healthcare system that really is untrained. So that said, how do you get this incredible system to be a part? How do you get it accepted and embraced to be licensed when we know that these are, for the most part, our long-term care are overrun by private equity who don't really care about the quality, they care about the profit.
That's right. So that's why I'm including profit in it. It's very attractive. They're going to make more money. There's no doubt about it. What's attractive about it is that we take the system you have now, the facility, not the system, but the facility that is in existence, and we adapt to that facility. Let me tell you that in 10 years from now, 20 years from now, you won't see what you see today. Because one requirement of the TDI licensing is to remove, not only unlock, but remove the memory care unit doors. They're locked right now. They call them locked units. Please remove that. That is absolutely cruel. That has to be removed, and there has to be free circulation. In 10, 20 years, I can see the entire facility open and people can walk out. To give you an example, that lady that wanted to go home, I would have been able to take her outside.
Right.
I would have been able to push her wheelchair and talk with her until she changed her mind and we could return to her space.
Right.
The reason that those units have been instituted is truly to protect the staff, not to protect the residents. I have seen people die behind those doors. I don't think that's acceptable, and therefore I find the system no longer acceptable. That's why I created this new business model, this new systems approach to dementia care. And I can tell you, Susan, that what's the good news about it is it's going to affect the entire healthcare system. Because if they could put a coach in hospitals, in psych units, we would do better with patients. So we need to look at the whole healthcare system. I know they're changing with AI now. There's a lot of changes going on. But maybe this is the right time to introduce the TDI, because everybody seems to be dissatisfied with what's going on. Mm-hmm. So you were asking me what transactional means. Transactional means exactly that. I want a person to be able to, like I did this weekend, communicate with this person. One time I had a man that was chasing me down the hall, a resident with dementia, and he was in tears. And I came back, I said, let's go back to talk to the nurse. When we got to the desk, the nurse said, I said, he wants to talk to his brother. And she said, well, his brother died, and he was pounding on the counter. I want to talk to my brother. I want to talk to my brother. And I said, and the nurse said he died, and she had tears in her eyes. And I said, that's so easy to fix. Mm-hmm. I started pounding with him, and I said, you love your brother, don't you? And he loves you. And the pounding stopped immediately. Yeah. Because your brain is hardwired for feelings. It's not hardwired for reasoning or logic. It's feelings: sad, mad, glad, and scared. And so if the person that's dealing with somebody with dementia cannot get down to the right side of their brain and look at feelings in that person, they never understand them, and it only escalates, goes right to anger, and then maybe some aggression as well. Dementia is not an aggressive condition at all. It's the way that they are treated, misunderstood.
Right.
So transactional is that. We want to
agree with you.
To know. Yes.
I agree with you 100%. I mean, I couldn't agree with you more. Again, I just want to understand. I love all of what you're saying. Everything is spot on. There isn't, like I learned the hard way, like most of us, because we aren't trained in it, right? And I feel like I got really good at it, and my mom and I could talk with no words from her. We had full-on conversations, though. For sure we did. And, I had her laughing, I had her swooning, and the whole thing. She was there. That took patience and figuring out, like you do with children. And I'm not infantilizing. I'm just saying when your brain works a certain way, it works a certain way. So you lean into the strengths, which are, like you said, emotions, feelings. So anywho, how do we get this corrupt system to see, like you said, the value, financial value in it? Are you being successful in it now, or are you still working that out? I'm fascinated to hear this.
Well, first of all, we just launched a program late last fall, so we're negotiating now with and talking sessions with larger organizations. There is money definitely for them to make, but let me tell you, as it is right now, those systems are unsustainable. They cannot sustain those much longer. And so the government keeps coming out with new regulations and new rules, and it's as thick as you can measure it. It's very thick. And so this is going to simplify things because we're putting the pressure, removing the pressure from management and owners. And also the pressure the way they're treating staff is unbelievable. It's almost they're like slaves. So please stop that. Please stop that. We want to make sure that, for example, nurses and CNAs are trained but tested on a regular basis, not to see if they pass or they don't pass. We want to keep everyone that needs to be there. But we want to know where they might need more information. They might need more support, more coaching. That's the purpose of the thing. It's not to punish anyone. and it's for the dementia coach to take the pressure off top management and the rest of them. And the TDI is really training everyone from owners to janitors and family caregivers in between. Now, we never start with saying, Susan, you have a nice business. We would like you to introduce the TDI. We want to assess your capabilities first. So we give them an evaluation sheet that they need to, because I've already refused some people. Why? Because I saw they were like slum landlords. They were there just to make the money, and we don't take those people. Those people will never change.
So what do
Unfortunately, there's such a large percentage now that are the private equity that are making, hand over fist, that won't care, as you say. But there's so many of them that are that. It's probably the majority now by far is private equity. So how do we get around that? Or do we just say, you know what, like you just said, we can't fix that, but we're going to do as much as we can with those who are not?
That's right. That's what we'll do. We'll step over those. Absolutely, we'll refuse them. Eventually, they'll see that they're not getting the business. Because, like you, Susan, wouldn't you rather put your mother in a TDI facility than where that's what we're looking at, and that's what people want right now.
Create competition. Yeah.
But it's also educating, competition. And it's educating the public to understand that there is a difference in care, right?
Yes.
So that, they can go in and go, well, do you have this kind of service? Do you provide this? And if they don't, then you look elsewhere. That, one of our interviewees, who's an assemblyman in New York, was saying that's one of his, cries, is to say we need competition, because without competition, everything is just staying the same. You'll hear in our documentary how the chaplain told me, my mom, don't worry about her because she has dementia, she has holes in her brain. You don't have to worry about her. She doesn't know anything. And I said, I think you got it wrong. I think you got the holes in your brain. You don't know, you don't know anything about Alzheimer's, clearly. But, this is and that's, it's a horrifying fact, but that we have these professionals that are working in elder care, where dementia is one of the main issues that we deal with as we grow older, one form or another, and yet they don't have any understanding of it. And so people are being basically warehoused in these kinds of situations where they're just billing and making money off of them.
Yes, and to follow up on Don's message just a minute ago, they're not only warehouse, they're actually doing elder trafficking, which is unacceptable. The other thing is that you have to, when you say the holes in the brain, what happens with dementia, to explain it quickly, there's a good theory behind it, and I was the one to discover it, so I'm teaching it now in the TDI certification program. We have two sides to our brain, a right brain and a left brain. Now, both of us are using right and left right now. When we get to emotions, we're into our right brain. When we get to asking questions, answering questions, we're into our left brain. A person living with dementia moves to their right brain, and they retire their left brain completely. Now, you can imagine if somebody comes to a person that's in their right brain, they no longer use their left brain, and they say to them, what did you have for breakfast today? That's a question that requires left brain information.
Right.
And they don't have it. So all they're doing, they're pushing them further into their sadness of losing memory, and then they may get angry because they're embarrassed, whatever it is. So unless the providers, which means the doctors, the physical therapists, the nurses, the CNAs, even your janitor, if they do not enter that room with their left brain and already functioning, they will not be able to communicate with that person living with dementia. It's very sad. After that, after they communicate with them, they can go to the left brain, because the nurse might have to do something, a treatment or something. That's a left brain property. It's not right. Mm-hmm. And so we train people like that. We have a very, like a 10-week training to get to become a dementia coach.
It's great. It's wonderful. It's something, and I think, like I was reading in your PDF that you sent about, family members getting that kind of education, because it would have saved us a lot of stress. My mom lived with Alzheimer's for 16 years, and so we learned by rote. But it took a while, and we cared about her. So, we were really, at least I was, and my daughters were very interested in figuring out how to make the best of the situation. And so, but not everybody has a family that has the time to, invest in learning as they're tripping. So I think, in inserting your education, that kind of knowledge is so important, and it should happen like early on.
Yes, actually, very, very good. And I like the point that you raised about the family caregiving, because even though your mother was institutionalized, family caregiving, at that point, you could have gone to the dementia coach and say, can you tell us how to better do here, because we see my mother is not understanding what I want to do. The dementia coach has all available solutions for families, for workers, for doctors. I had doctors that came in and did not know how to approach my husband, and I'm sure you saw that with your mother. I had to fire a couple of doctors because they just didn't seem to want to get it, and they didn't ask for it. I had the only doctor that had asked me was an older doctor ready to retire. He said, please teach me.
Aw. Yeah. No, it's actually horrifying. I mean, I remember when my mom was in the early stages, and I would take her to the doctor, and the doctor would, they'd lose their patience, really. And really, they actually exasperated any kind of behavior that they didn't want by asking her questions that she couldn't answer. So my mom, being, the force that she was trying with all her, sense of humor and her joie de vivre to step up and really, meet what they were asking for, but it couldn't. And instead I know what you said, it certainly did embarrass her, and it certainly did hurt her, and I did a lot of damage control, and that's just so unfair and so unkind.
Yes, that's right. And even when for dental care with my husband, the dentist didn't know how to. They were afraid. Why? Because there's something out there. People say, I hear that all the time, that people can be aggressive when they have dementia. Or the worst one I heard the other day is a woman said, my sister's living with her husband and he's been diagnosed with dementia, and they sleep together. Do you think she can catch it that way?
Oh my gosh.
Yes,
oh my
yes,
gosh.
yes. So those kinds of things, they can be answered by the dementia coach. Also, when you go to the dentist, the dementia coach could prepare you to help your mother, help me with my husband to do better. And I used a lot of Reiki, to calm my husband down, and also to communicate with him. Once he couldn't speak anymore, I used Reiki. A master Reiki was helping me to understand him better.
That's amazing. Can I tell you a really funny story, really fast, funny story? My mom needed to get a biopsy when she was living with me. She had a mammogram came back, and they needed to do a quick biopsy. And I took her to the doctor, and they said we were waiting in radiation, and they said, okay, Norma's next. And I said, okay, do you want me to go in with you? Oh no, we were fine. I said, she has Alzheimer's, right? We're fine. Wasn't 30 seconds, they were back out there with her. She was like, I'm not getting on that table. Are you kidding me? Leave me the hell alone. Get away from me. And so they said, maybe you need to reschedule. I said, are you kidding? No, we're here. I'm going in. I put on the coat. I got under the table because she had to go sit on this table with a hole in it, right, for the boob. And I said, I sang songs. I made her laugh. We got that biopsy. I was like, we're not leaving. But I mean, they don't know. They didn't know. They were like, they had no clue. 30 seconds, they were like, yeah, we can't do it.
Yeah. But it was still traumatic for your mother at first.
Sure.
And one thing they asked me for my husband, they wanted to do colonoscopy, and I said no. He has dementia, and there's no more exams of that sort for him.
Right.
He lived 21 years very well.
So
Excellent.
because family is such a big component of TDI, and as Susie said, not everyone has family, or not everyone has family who care enough to get involved. How does it balance out for those who do not have family? You know, how does the staff have to, I mean, how is that worked into the equation so everyone gets similar care?
Right. Well, when my husband was in long-term care, I acted as a dementia coach, and I was the family member for a lot of families. Because you're right, a lot of them don't have families, or the families doesn't want to get involved, period. I've heard of a story where the man brought his mother in and said, don't call me, only call me when she's dead. So that person was left alone. And with the TDI, we look for a small percentage. Not every family caregiver will qualify to be a TDI care partner. They have to be well balanced, they have to be intelligent enough to understand the training, and they have to be willing to show up.
Sure.
So
Available,
we have a lot
yeah.
of people that we have a lot of people that want to do that because they want to be there for the last breath. They want to be there to the end of life. That's what commitment means when you're married or you have family. If it's your mother or father, you want to be there. But some people don't, and that's fine. We don't discard that. We don't look down on them. We just take the ones, just like the organizations, the ones that will pass the assessment and are willing to do it and trained, and they have a dementia coach to back them up.
Is there any component of leaving this to me? Because I know Susie, when her mom lived with her for a year, she still needed a caregiver with her also to help. And for a while, she would be going to these agencies, and they'd be sending over these caregivers who were, you know, supposedly trained in Alzheimer. And they were just, I mean, one of them after an hour was like, I'm out of here. You know,
Because my mom was she was, you know, was walking, talking, and she was going through that stage where
she wasn't mean, but she wasn't mean.
mean.
She was just,
But
you know.
she was like, I don't have Alzheimer's. You've got Alzheimer's, not me.
You're
you know?
crazy. Yeah.
She was in denial, and you know, and they didn't.
Can this system be used for the, I mean, could this type of training be used in that? Because a lot of people are in that situation where they're not in a particular facility, but they are utilizing those type of caregivers.
Outside caregivers, yeah.
Yeah.
When we say dementia care, we involve health care, home care, assisted living, long-term care, daybreak,
Hospice.
all those systems. Wherever you deal with dementia care, you ought to be trained for it. So what you just described is, I went through that as well, Susan. One time there was a woman that came in and she happened to shuffle her feet, and my husband said, I don't want her, she's shuffling her feet too much. And it was easy to replace people because none of them had training.
Right.
And so when they came into my home, I had to train them the best that I could, but with limited responsibilities, because I could see they had no training whatsoever, and I understood they weren't paid very well as either. That's why we included that 6-hour work for 8-hour pay. It's much better.
Right.
And we don't want shifts. Even nurses cannot work long shifts in our system.
Right.
They can't work double shift like they're asking for them to do now.
Right.
That has to stop. So it's going to change everything. But Susan, you would be involved. You would have been trained as a TDI care partner, and we would have welcomed you, and you would have had a ball.
Oh yeah. No, I would have been up for it. I was up for it anyway. I learned on my own. I figured it out, you know. But I was motivated. It was, if I wasn't going to cure it, which I thought I would try, I thought I was going to cure it. That didn't work out. So if I can't cure it, I will teach it who's boss. And I tried my best. But, you know, I find it very frustrating that, and you know, and I'm sure you do too, that, you know, we all know and doctors know this for a fact that a very large percentage of our well-being starts here, right? And
Yes.
so, and it is, and it's so important, when you're going into surgery and you'll hear doctors, you got to go in with a good, positive framework. And we know that it helps healing. We know that it's not ooey-oo, it's for real. Because our minds are very strong. And for some reason, after a certain age, well, we know what the reason is. It's called ageism. That component of the healthcare system is not addressed. And so it just becomes, addressing the physical needs, and forgetting about the other component, the mental, the emotional component of well-being. And I would often say that to the facility where Mom was at, is like, what quality of life are we doing here? Like, what is the quality? Like, let her eat. She wants to eat. That's her life, is eating. If she chokes, she chokes. But staring at a wall with nothing to do, and that is not life. And
That's true.
And I don't know why it is not part of, geriatrics, that we don't deal with that part of living. Otherwise, let's just all take a pill after a certain age, right? I'm being funny, but not,
I think you know the answer already, Susan. Our society does not respect the elderly. And yet it's the most beautiful part of life, because by then you have experience, you can relax, you can say whatever you want. You know how to do things. You've seen life. You look at the younger ones and you wonder if they're suffering because you have suffered. You know what it's all about. Mm-hmm. You have empathy. So our society needs to start to understand that, just like they do in other societies, that there's a lot of wisdom in the elderly. Let's go and see what that is. And you're right. There is not enough life. There's not enough activities that are really what they call, centered care. For, you look at what the person likes or dislikes, and you meet those requirements. That's just, to me, I've seen so much of it and I've heard so much that I think it's just words. Let me see the action. I want to see it in action.
Right. I remember, I took my mom out of memory care. Like, she wasn't supposed to go into memory care. My stepfather, who didn't have dementia, passed away. They were just moving to a new facility together, assisted living. And when he passed away, they said, oh, well, she can't go into the regular side because he's not there to be, to help out. So they said, we're going to put her in memory care. And I mean, within a month I had her out, because every time I got there, she was an emotional basket case, like crying. Mm-hmm. She was like, and I remember when we first went in there the first day, just getting back to what you were saying about activities, there was all these people sitting around a table cutting paper flowers. And my mother said, what am I, 3 years old? Get me the hell out of here. What the hell is this? And she goes, Susie, don't leave me here. Right? And I was like, what am I? And, and then they start, which we address in the documentary, the gaslighting is like, you have caregiver stress. This is what's best for your mom. Trust us. This is good this is safe. This is, this is where she belongs. Don will tell you, because we've been friends forever, like my daughters and I went in there one day and I said, grab her purses and start shoving her stuff in there. She's out. I'm taking her home. This is not a place to live. Nobody should live in those places like that. It's awful.
Well, it's similar to what I heard the other day when they take your keys away because they can't drive out of safety and so on. It was recommended that somebody takes your keys for only 1 week. Only 1 week, and see how that feels. But I understand what you're saying, and person-centered care is not what they do today. Right. Most of the time. There's just very few instances I've seen. I've seen a program like that in Australia, in other countries. But in the United States, it doesn't matter how much you pay. I had a friend from New York say, oh my gosh, in You know, in New York, there are places that are very, very expensive. I imagine that the care is better. I said, not really. It doesn't mean
Well,
because you
yeah.
pay that it's better.
It's interesting. My mom's in assisted living, and she pays a lot.
Dearly.
Dearly, and it's a beautiful, absolutely gorgeous facility, and they've got great food, a beautiful restaurant, and one of the things we liked is the caregivers there were very social with my mom. They'd come, they'd sit down, they'd spend time with her. Well, all of a sudden they get the notice, no more socializing. It's taking up too much of the CNA's time, you know. And now they've
and you know, Dawn, I'm sorry to interrupt you, but it's a matter of time, and the people that are there, the CNAs, there's not that many. They allow them 6 to 16 patients per person.
Yeah.
It's ridiculous. But imagine with the TDI model, your mother would have you there, or Susan or myself would be visiting, and we would help her. We would do the socializing.
Right. Yeah, I mean, and in terms of like, just to piggyback off what you just said, Dr. Lord, about, you know, all of us being involved in this system, you know, Medicaid, once a person outlives their savings and they have to go onto Medicaid. Well, Medicaid doesn't account for those kinds of extras, which they consider extras, you know, and so, or Medicare, you know, as well. Those all become extras that, you know, it's really about keeping the body alive, and the other parts aren't paid attention to. That emotional component is not paid attention to, and it's not compensated through the programs that we have in place now.
Yes, it's very dangerous. We're looking at a future that is not very good unless the system changes. It's very bleak. They're going to get rid of those people just like that, right? Because as Hitler used to call them, they're useless feeders. But that's not true. I'm telling you, the wisdom that each one of those people, even with dementia, that's why my next book, A Gift of Dementia, the Gift of Dementia, a gift that has yet to be unwrapped, is because it is a gift. I had learned so much from my husband. If he had not lived like that, I would be clueless of what dementia is. But it's beautiful.
I second that emotion. You know, I think everybody that's gone through this journey with me and my family and my friends have all been enriched by it. You know, as sad as it was and is to lose those facilities, there's a whole nother way to look at life, right? And so, you know, it is the epitome of Zen. It is in the moment. You can't live any more in the moment than that. Right?
That's all we have.
That's all we have. So it's
but we don't know that. They're pointing it to us.
They're saying, this is it. This is manna. This is manna right here. And that's really it. And I learned that. I learned that with being with, you know, like I'm getting chills when I say that, because it's true. Because it throws me back to sitting next to my mom's bed and just, you know, surrendering, not thinking about where I have to be or where I was, just surrendering to the song that I'm playing on my phone and singing along to, and making sure that she's liking this song, you know, and that's all it was. It was that.
And you were sharing a gift that's natural, Susan. You were sharing nurturing. You're a nurturer. And your mother was just soaking it up.
Yeah. Yeah.
You can see it, you know, you could see it when it was happening and it's just literally moment to moment to moment. It's not about the past. It's not about what's coming. As Susie was just saying, it's literally that moment. And, you know, and for both the caregiver and for the person.
I mean, we learn from our children, right? I learned from my children watching, you know, my children like take these social risks that we don't do because they don't have any fears, or they don't have any, you know, filters, or they haven't been hurt yet. So they're very fearless. And like you said, as you get older, you also get fearless. You lose your filters because you kind of got it. You get it. you know, and I love that. So I love watching it. And then, and, you know, I got my mom, we were all very grateful that my mom got to meet my granddaughter, who was only got to meet her on Zoom because of dementia, because of COVID. And then when the doors opened up, she finally got to see my mom in person. She was 2 years old and crawled right into bed with her and was loving on her, looking at her face, laying on her, looking at her face, rubbing her, patting her, and saying nanny, nanny, nanny. And the two of them just had a full conversation without any words.
That's right. Beautiful. Thank you for sharing that.
Yeah. Yeah.
Beautiful.
Because they didn't need the words. They knew each other. They knew.
Well, because again, I used to say, CNAs, before you enter a room, make sure your energy is positive and you're relaxed, because people with dementia will read energy faster than you can blink an eye.
So true.
Yep.
To anyone listening, it's so true. Children do the same thing. They're very perceptive. You know, when you don't have language taking over, you connect this way. And so it's so important. I always did it in, you know, I don't know where it came from, but I always walked into my mom's room, took a deep breath, and was like, "Hi, Mommy, I'm here, your daughter, your favorite daughter. Okay, whatever, I am your only daughter, but I'm still your favorite." You know, just to remind her who I was without her having to guess. And to be up so that she would be up.
Yes. I remember one of the caregivers that my husband had, the private caregivers when he was still at home, was she would come in dancing and singing into the room every time. And it ended up that he asked to marry her. He said he wanted to marry her. I said, well, I think we can arrange that.
Aww.
And he took his ring off.
Dr. Lord, I love you. You're so great. That's beautiful.
Yes, and then he had fallen in love when he was a young man to young officers in the Air Force. And that came all back because old memories come back. And he said to me one day, he said, I hope I won't offend you. I hope you won't be sad. I love you. But I've been thinking about this woman that I was in love with when I was younger, was a young officer. I said, you know, if you give me the name, I'm just like Columbo. I'll find her for you. And so he gave me the name. I found her in Chicago. And I communicated with her, and to the time of his death, she was sending him letters. She was calling him when he was able to talk.
Who are you? You're so sweet. Oh my gosh. Isn't this a great story, you guys? I mean, this is true love. That's love.
Yes, it is true love. We don't own love. We can only exercise it.
Oh, I love it. You just
when he
making me
wanted
cry.
to give her gifts, he wanted to give her gifts for her birthday, and I did that. We went out shopping so that he could have a full experience. But here's the gift for me, the gift of dementia in that. The gift was I saw that young officer that I never knew.
Oh, yeah. That's interesting.
Wow.
And you know what? I'll match you with that. So, my mom's life, I didn't know why, but all of my great aunts, my grandma's sisters and brothers, and those who sort of co-raised my mom like they did back in the day, and she was in New Jersey, they all, whenever they see her, they come and visit, they call her Lovey. That they never called her Norma. It was Lovey. That was her name. Done and done. All cards made out to Lovey. And I never asked why. I didn't know why. I didn't think about it because, you know, you're a self-centered child. You don't know until, you know. And as my mom progressed and was in nursing home, and I'd go to visit my mom, and hands down, without any, she wasn't even speaking at that point. Is your mom Norma? We love her. She's so loving. She's so affectionate. She's so, and I said, oh, that's where she got the name. That's why she was Lovey. And she was exactly like that the whole time. She's just, people would walk by, and when she could still talk, she'd go, "You're beautiful. You're beautiful." And they'd go, "Oh, thank you. Thank you."
And she meant it.
Yeah, she meant it. She meant it.
But that came out, that was even after she had stopped talking. The CNAs would always comment, "Oh my gosh, I love your mother. She's so," I mean, everyone, without her saying a word. That was
And
just
I
her
realized
essence.
this is
And
her
I
as a
think,
little girl. This was my mom, who she was without all the other life that weighs you down, right? So I got the chance to see her as a little girl with that free.
Yes.
So I got to see her like that. So I shared that with her. And
Yes.
and I'll tell you one other thing, because you'll love this as a dementia expert. When, like, 3 months before she died, and she had stopped talking, and the only reason why she stopped talking was because she had been intubated, and anyway, they didn't give her, she could have still talked, but it went atrophied. I was talking to her, and I was doing my dog and pony show, and I was singing, and I was trying to make her laugh, and out of nowhere, she just leaned forward and said, "I love you," like clear as day, like it was ever my mom. And Dawn was in the room, and I was like, "Oh my God, Mom, that was like a marathon you just ran." Because I know how hard it was, but she needed to let me know. And she
Yes.
never talked again. But that
Yes.
he did all those things that she had to find the words, bring them down, attach them, and get them out the mouth. That's a lot.
That's a beautiful sentence to leave you with.
She sure gave me the.
By the way, I'm not a dementia expert. I just have knowledge in dementia.
Okay.
I don't ever want to call myself an expert. I see experts on the LinkedIn program there that are maybe 20 years old or 30 years old. I can't imagine being experts. It's a long, you need to live a lifetime almost to say you're an expert. But I always say that we don't invent anything. So experts kind of insinuate you invented something, but we only discover things. They're all there to be discovered. It's up to you to discover them.
Right. Good correction.
Yeah, I don't know if there's any true. I don't know if there's any true. There's so much unknown about dementia that I don't know if anyone's really an expert.
We never will. We never will.
Yeah.
Right. Yeah, and it all comes down to, individuals, what part of their everything. There's so many factors that come into play. So, yeah, it's interesting. We went to see a screening of another film on dementia last night, and it was very frustrating. Having been through the whole journey, and having made a film, about Alzheimer's in a narrative way. I was very careful to be very honest and open and as true as I could, bringing in the comedy, but also bringing in the truth, and I think that it does disservice. It does a disservice to the public both ways if you sugarcoat it or if you, like vilify it, so you're only adding to the stigma of it. So either way, it's bad. We really need to really understand the scope of it so that we don't, dismiss it or ignore it,
Right.
Or fear it. You don't want to fear it either.
That's right. The organ we're talking about is the brain, and it's the most complex organ in the body, and we'll never understand it fully. And what works with one person may not work for another one. That's why the tips on dementia care are so important, because you can have a choice. You can try different things to make sure that you can shift the feelings of that person and make them feel safe and loved. That's the only thing they want, to be safe and to be loved.
Yeah, definitely.
Just bringing back to the TDI, I just wanted to clarify, does the TDI program work with Medicare and Medi-Cal facilities, or is it just private pay, or a combination thereof?
No, it works for every facility. It does not matter if it's private pay or Medicare or Medicaid. The Medicaid situation is that in a facility they can only fill so many beds with Medicaid because they pay so much less. It's less pay, so they want to make money. There's billions of dollars being made daily in long-term care. Don't fool yourself. They're not running out of it, and they're not underpaid or anything. It's how they fill their beds, and of course, if you can pay with insurance, long-term care insurance, or if you have enough money, that's the best way for them to do it. There are some that are totally private. The TDI will work very well with any system. It does not matter.
Okay,
Right.
great. Thank you.
But it is
Thank
a
you.
matter of like whether that facility will incorporate it, and whether they're going to bring that system into their facility to use it on a consistent basis. Can families request it and say, I guess you can't. I mean, you can request it, but it doesn't mean it's going to happen. So what you do is look for a facility that does incorporate it.
It would be nice if families would say, we heard about the TDI business model. Have you heard about it? Let's inquire. But remember, they have to pass the assessment. If it's a type of business that's just in it for the money, and they provide very bad care and they intend to continue, we can detect that in the assessment stage. There's a period of a few weeks that we do an assessment, and we're very honest about that. We'll tell them exactly what's up.
Right.
And how many TDI facilities are there right now?
We haven't signed anybody officially,
Right.
but we're still
It's
discussing, and we will have them this year, I'm sure. Maybe we
Gotcha.
could have this discussion later on.
No, I hope
I
so.
hope so.
I really do. Yeah, it's like I'm learning about all these different models for like the greenhouse model, and the Eden project, and all those different, all the person-centered care for long-term care, which is all really good and it's well thought out. And one of the interviews that we did for the documentary, I asked a hard question, and I said, well, who is enforcing this construct, this paradigm of teaching, or
This model.
management,
Like-
this model, right? Because if you send your child to a Montessori school, there is licensing, and there's you have to adhere to that program, or you will lose your license. And the woman who is running this program, one of them, now it's an offshoot of the greenhouse, said there really isn't anybody overseeing the licensing or the quality control, and it's really up to the individual. Well, that just leaves everybody vulnerable.
That puts us right back where we are. Yeah.
Because it might sound good, we've got new and improved. We are the
Yeah, then
greenhouse model.
it's just a marketing tool at that point.
It's
You know,
another
at that
marketing
point, it's a-
tool.
Yeah.
That's why we're licensing the TDI. We're overseeing every step of it. They have to even present the curriculum. The dementia coach has to submit her curriculum. We visit the facilities unannounced, and we just straighten out whatever, and we're there to support them. Absolutely support them the whole year, and it's renewed every year. It's a yearly license. It's not a forever.
Have you thought about going to, I'm sure you have, going to CMS and presenting this program to them as to, incorporate into their system?
Unfortunately, they're so large, and I have approached the government on this, but there's other things driving the government, and not necessarily when it makes sense or
Yes.
it's a better thing.
Like the lobby.
That's not.
like the,
Yeah.
Yes,
like the
yes,
nursing
it's
home.
not a sure thing, but I don't give up on them. I still continue. I know the Alzheimer's Association has a big say in everything that might come down the pike, and that's been submitted to them, but they've ignored it completely
Yes.
because they probably feel it's a competition, less
Yes.
funds towards their drives. Yeah.
Yeah. It's very complicated.
But it's people like you, Susie, that and you, Dawn, that can help us to change the course of dementia care, and I beg that you to do that, please.
I was
As much
just going to
as
say
you can.
that is our dream. My dream is to, awaken the collective conscience and really let people know that this is their future, And, it's all of our future, and it's only going to get exponentially worse if we don't nip it in the bud now. And we are the only thing that's going to change it. It's not going to be, new legislation, because there's no one there to enforce that new legislation. That's just platitude. So we really need to take it into our own hands and really take our healthcare back, and and secure it, and ensure that we have. If we're going to try to live longer, which we all are doing, we really want to have longevity. Well, you want to have quality with it too.
Yes, because we are all going to end up old, and we may many of us will end up in a facility.
Right.
Because, as Dawn said, we have either no families, and one thing that the International Caregivers Association strives for is inclusivity. And imagine those people have less family than most people.
Absolutely.
Because sometimes they're abandoned by their original family, and if they're left alone, the partner is passed on. I want the TDI care partner there to love that person, to support them, to offer them safety.
Yeah,
Absolutely.
and know that even if you're paying $10,000 or $12,000 a month in a private, that does not guarantee the type of care that these people need, because those facilities still don't understand
No.
half of what they need to
Absolutely.
do.
It's
And so
like
you
our,
need,
yeah.
we need something, it's not something like, or TDI, to be part of these systems. So whether you're being paid for by Medicare and Medicaid or private pay, the care has to be correct. It doesn't, just
Right.
because you pay out a lot of money doesn't guarantee that.
You can't buy
No.
the lobby, folks. Don't buy the lobby. Look behind the lobby. Go really, really investigate, because lobbies can be very deceiving. And
Absolutely.
right? Yeah.
Yes, I agree. I agree. But the fact that we have a dementia coach in the center of the organization, and one dementia coach in every site that business may own. So if they only have one, then they only have one dementia coach. But if they have 600 different sites, we want 600 dementia coaches.
Right.
And right now, as I know it, and I've seen it, all healthcare workforce would love to have that kind of support, that kind of training, that kind of person that will come and fend for them when there's a problem.
Absolutely.
Yeah.
Wow.
Yeah,
I
think
love
how much
what
better
you're
it is
doing.
for the healthcare provider, for those CNAs, those nurses, those doctors. If everyone, has this knowledge in practice, their jobs would be so much easier.
Well,
and
yeah.
their
Oh,
life would be so much better. Yeah.
Well, it's like
Absolutely.
it's like sticking somebody who's a manicurist and go help them out.
Put out
in
a
this-
fire.
Go put
put
out
out
a
a
fire.
fire.
It's like it's absurd. It's insanity. It's insanity.
And,
We put unprepared and uneducated people in to help people, and it's just it's a disaster waiting to happen. Of course it is. Of course it is.
Absolutely.
Of course it is. Well, is there anything we left out that you wanted to mention before we wrap up this?
Well, if anybody wants to get a hold of me, they can get a hold of me at the International Caregivers Association.com website, or icacares.com. They can go through there, and there's a contact page, a lot of information on the TDI. We have 3 different teams there. We have the leadership team, we have the advisory board, we have the consulting group also that goes into facilities and opens the door for the TDI.
Lovely.
So very well qualified people all around me.
Take advantage
very
of it, you
prepared.
guys. It's there for the taking. Take advantage
And
of it.
push for it. Push for it. Start using your voice and say, this is what we need. This is what we want.
Yeah. Yeah.
Let the facilities know. Let everyone know that this is the type of thing that we absolutely must have in order
Yeah.
to ensure, safe health care for everybody. both
Quality.
in long-term care and healthcare in general.
And quality, yeah. Like you have to push that. It's unfortunate, but we do. We have to advocate for ourselves and our loved ones, and it takes megaphones and, and don't have the disease to please like me. That does not work. That does not work. You have to be strong. Okay. Well, you're delightful. I love what you're doing. You are a warrior. You are a warrior with a heart of gold.
Oh, thank you.
Yep.
Thank you for saying that.
Absolutely. Absolutely. It's a pleasure to know you, and I'm rooting for you. And I hope that our documentary makes some kind of shift and allows, an open door for this everywhere. So important.
Yes.
So
I
important.
think you ought to consider a documentary just on the TDI to change the course of dementia care.
After I get a break, it's like asking a woman who just had a baby, when are you going to have your next baby? I'm tired. No, there's a lot of documentaries that need to be done. I hear you. No, but it's true. It's true. Yeah, because I see that very clearly. It would write itself. It really would. It would write itself. Well, this has been very lovely, and it really plays to why we do the show, which is why, Dawn.
That's because love is powerful, love is contagious, and love conquers all. We thank everyone for watching, listening today. Please like, share, subscribe. Check out TDI for sure, and we'll see you next time.
Yeah, and one more thing. I know that you guys have a lot of different podcasts out there, and right now there's so many. But we've been doing this for 4 years now, and we really do it because we love it, and we really love to bring you the best people. And I feel like Dr. Lord is one of them. So have you all have a great week, or till our next episode, and you'll hear from us then. Bye.
See you then. Bye-bye.